Progress.
Everyone. My name is Emily, and I am the Events Advisor with the Ontario Ministry of Long-Term Care. Thank you for joining us for this announcement. To begin today, I will just go over a few housekeeping notes. Please note that auto captioning will be available for the duration of the announcement. The announcement is also being streamed to our Government of Ontario YouTube channel. After the announcement has concluded, we'll open the session to questions from the media. If you are a member of the media, we would ask that you please rename yourself to include your organization with your name. If you would like to ask a question during that time, please use the raise hand icon on your screen. When your name is called upon to ask your question, you will receive a prompt to unmute yourself. Accept the prompt and ask your question in the format of one question, one follow-up. Please refrain from using the QA tab. This announcement is also being recorded. Now, at this time, I would like to introduce the Honorable Dr. Merrilee Fullerton, Minister of Long-Term Care, and invite her to share some more details about today's announcement. Minister?
Thank you, Emily. And just before we get on to what is a very excellent announcement, I really want to state unequivocally that hate and Islamophobia has absolutely no place in Ontario. And given the very tragic, heart-wrenching events in London, I think this needs to be said. This is a time for Ontarians to come together, to support our Muslim community, to show them kindness and compassion and support now and over the coming weeks. This is a heart-wrenching time, as I've said. And I want to thank the London Police and the RCMP for investigating and being involved in the investigation of this heinous situation. And any details related to this, I would direct people to the London Police Service. So let's come together to support our Muslim community at this heart-wrenching time. Thank you. And with that, I would like to begin today's event. And thank you so much for joining us. We are making important progress in long-term care. And this event today is part of the progress. It's really a pleasure to be here to celebrate the significant construction progress of Schlegel Village's the Village of Winston Park home in Kitchener, Ontario. And thank you to MPP Amy Fee for Kitchener South Hespeler, and to MPP Mike Harris Jr., MPP for Kitchener Conestoga, for being here today with James Schlegel, President and CEO of Schlegel Villages. So thanks to all of you for joining today. And above all, thank you to the passionate and hardworking community in Kitchener who helped make this project a reality. Our government is focused on making long-term care a better place to live for residents and a better place to work for staff. We are investing up to $4.9 billion over 4 years to create more than 27,000 new positions for personal support workers, registered nurses, and registered practical nurses in long-term care. And this will allow us to deliver on our commitment to increase the hours of daily direct care to an average of 4 hours per resident each day in long-term care. This is an ambitious commitment, and it will make Ontario a leader in Canada. The previous government took 7 years to build just 611 new beds, and we are building 30,000. 30,000 safe, modern, comfortable spaces for our seniors to call home. And we are investing $2.6 billion in projects like this one to make good on our commitment to repair and rebuild capacity in long-term care. We have over 20,000 new and almost 16,000 upgraded spaces in development, more than 60% of our goal of creating 30,000 new spaces in a decade. The new and upgraded beds here at the Village of Winston Park are part of this important goal. And these beds will provide Kitchener residents with a comfortable, modern place to call home. With the support they need now and in the future. I believe someone's mic is not muted. Investing in projects like this one also improves working conditions for staff in long-term care homes. This is so important as the staff in homes do vital work every day so that our loved ones receive the quality of care that they need and deserve. Today, we are celebrating the significant progress that has already been made on this home. Construction on this project is well underway. Phase 1 of the project will build 128 new and upgraded spaces and is scheduled to open in February 2022. And phase 2 of the project will add another 64 spaces and is scheduled to open in June of 2023. And that means a total of 192 modern spaces for the Village of Winston Park and seniors in Kitchener. More than half of these spaces will be brand new, and the rest will be older spaces upgraded for the 21st century to modern design standards. These spaces will be built to, as I said, modern design standards and provide residents with a safe and comfortable place to call home. And I think that's such an important piece, the concept of this being home for our residents and part of the community. The home will be part of a campus of care that includes primary care, adult day services, memory clinic, and retirement suites. This is truly a pathway forward in innovation. The Village of Winston Park builds on the many actions of government that we've taken already to make long-term care a better place to live and to work. And once again, thank you to the community that has rallied around this project. So thank you for your hard work and dedication, and congratulations on all the progress that you've made already. Together, we are fixing long-term care. Our loved ones deserve nothing but the best, and the best is what we're building. Thank you. And I will now turn it over to MPP Amy Fee, my excellent colleague and MPP for Kitchener South Hespeler. Thank you so much.
Good morning, and thank you, Minister, and thank you definitely for being here with us today and making long-term care expansion in Waterloo Region such a priority for your ministry. And thank you to James Shagel and all of your amazing staff and all you do every day for all the seniors in your care, especially what you've done throughout the pandemic over the last more than a year now. And we are very grateful for all that you do for all of our seniors. We're certainly honored to be here this morning as you bring us up to date on the progress of the expansion at Schlegel Villages. And thank you for inviting us to share the celebration of this incredible milestone. This expansion is certainly important for seniors and their families right across the region. And I look forward to a day when we can actually all come and see it and celebrate this project in person. And now I'd like to invite the MPP for Kitchener-Conestoga, Mike Harris, to join us.
Thank you so much, Amy, and thank you very much to Minister Fullerton, obviously, for being here today and for helping us to celebrate the progress that's being made at the Village of Winston Park in Kitchener. And it's, of course, no secret that long-term care was neglected for 15 years by the previous government. As the minister said, in 7 years, only 611 beds were built across the entire province, while waitlists in communities like Waterloo Region ballooned. Almost immediately, our government put the wheels in motion to create 30,000 new spaces. One of the first homes to receive these new beds was the Village of Winston Park back in the fall of 2018. In the second half, in two short years since that announcement, the shovels have gotten in the ground and the remarkable progress has been made on this project. No time is being wasted getting these 192 modern spaces finished, so that seniors in Kitchener and across the region can get access to the care they deserve, close to their family, friends, and support networks. And I want to thank Jamie and everyone at the Village of Winston Park for sharing in the commitment that our government has to building more beds and providing dignified quality supports to our province's most vulnerable seniors. Undoing over a decade of neglect from the previous government is going to take time. But Minister Fullerton and all the members of government are committed to staying the course and getting this right. These residents are the generation that built this province. They are our loved ones, and they deserve a comfortable and modern environment to live and receive care in. We've announced over 820 new and upgraded beds in Waterloo Region alone. Beds that are in the pipeline and being constructed or retrofitted as we speak. Again, thank you to the Minister of Long-Term Care for not only announcing new beds, but delivering real progress to Waterloo Region and communities across Ontario. Your dedication to long-term care residents and their family is what's driving forward our plan to create the high-quality long-term care system seniors deserve. Now, it's my pleasure to hand it off to one of our many local champions in Waterloo Region, James Schlegel, the President and CEO of Schlegel Healthcare. But before I do, I just want to express my appreciation for all the nurses, PSWs, and support staff, and all the hard-working people that have made caring for our local seniors their career. We can build all the beds in the world, but without these folks helping our residents, they mean nothing. So just a big thank you to everybody who's done such amazing work through the pandemic. And with that, Jamie, the floor is yours. Thank you.
Thank you, MPP Harris and MPP Fee and Minister Fullerton for those very kind and thoughtful remarks. And I do want to echo the comments that each of you made in recognizing and thanking the team members of Schlegel Villages and the staff across the long-term care system who have who always do amazing work in providing care and quality of life to seniors living in long-term care, and have shown themselves to be true heroes during the pandemic that has hit our long-term care homes and residents so hard over the last year and a half. So certainly appropriate to start with that recognition and that gratitude to our team. Schlegel Villages is a three-generation family organization, started back in the early 1950s with my grandparents. It's something that I'm quite proud of as part of the third generation, and we've been dedicated to providing dignity and quality of life and a high quality of care for seniors in Ontario since that time. And we have, as a family and under my father's leadership and creativity, developed a unique village concept over the past 40 or so years that is a campus of care organized along a main street and town square center. And the main street is the social spine that connects the various parts of the village, the various neighborhoods together into a community. And it was really intended to foster socialization and social connectedness for our residents and our team members and family members, to create a true community where every person can thrive and reach their full potential. The Schlegel Village concept also includes a partnership with the Research Institute for Aging, which is a larger partnership with the University of Waterloo here in the Waterloo region and Conestoga College, to bring the worlds of research and practice and training together and conduct research in our villages, Winston Park being one such innovation site, to drive innovation and create new and better solutions for our elders as our population continues to age. And so we see ourselves very much as an innovation engine for not just our organization, but for the entire system. Winston Park was, we got involved in Winston Park, I should say, in 1986, when it was the old Winston Hall nursing home on Woolwich Street in Kitchener. And then at the time, the new and modern Village of Winston Park was opened in 1991 with the current 95 long-term care beds. And then future phases of the continuum or the village were added over time to include the retirement home and assisted living memory care and seniors apartments. And so this will actually be the 5th phase of Winston Park as it continues to grow and evolve as a village and as a community. And obviously, we're pleased to be able to expand the long-term care beds that we have, as the minister mentioned. We're also pleased to continue to expand our seniors health hub concept. My father's always envisioned these villages to be community centers for seniors in the broader community, and to be a support for those folks to be able to live longer and more successfully in their own homes. One example of that is we're providing space in this edition for the KW Senior Services, a partner of ours, to provide 30 seniors day program spaces for folks in our community living with dementia who need some support. So that will be embedded in the lower level of the long-term care home to provide those outreach support services. So we're quite pleased to continue to evolve and expand our services out to the members of the community. So we're so super pleased to receive this government support to expand and modernize our long-term care home. I think there are 3 important benefits to that. Number one, as the minister mentioned, to be able to provide more modern spaces that our seniors so richly deserve, provide more space, higher quality space, more privacy, more ability to implement good IPAC procedures, which we've been reminded through the pandemic how important those are. Also, secondly, in adding LTC capacity, we are providing better and faster access for long-term care services for those who need it. And of course, that is important as our population continues to age. And thirdly, that because this is a campus of care, the more LTC beds we have on site, the more ability we have to make the continuum work well for our residents, so that as their care needs change over time, that they can get the care that they need and have access ultimately to long-term care if they in fact need that. So we will see the benefit of these additional long-term care beds for the community, as well as for residents currently living at Winston Park. Construction is coming along very well, and we're on target to complete that construction the end of this calendar year, to start team orientation and the opening process in January, and then to receive the first resident, as the minister mentioned, in February of 2022. So on behalf of Schlegel Villages, the Schlegel family, Minister Fullerton, a huge thank you to you and your government for this very important support of our organization, but most importantly, support of our seniors and our community. We will continue to do our level best to bring quality of life and quality of care to the seniors of this region. So thank you so much for being part of this event and for supporting our community and our seniors. Thank you.
Okay, so we'll go to the media for questions. Just a reminder, if you'd like to ask a question, to use the embedded raise hand function on Zoom. Just a reminder, it's 1 question and 1 follow-up. The first question goes to Jessica Smith-Cross for QP Briefing. Please unmute yourself and go ahead.
Hi, Minister. Good morning. I'm looking for an update on the status of the investigations into deaths from neglect in long-term care. What can you tell me this morning?
Well, thank you, Jessica. You know, this is something that we are taking extremely seriously, and our inspectors are investigating this in conjunction with the coroner and the coroner reports. This is something that we have promised to do all along, and we had inspectors into this home very early on when there was concerns about its functioning. And when this information came out in in the commissioner's report for the Commission for Long-Term Care, we've taken action again. And so we're waiting to hear back from the full investigation. Thank you.
Can you confirm, sorry, which home you were referring to there and how many homes overall are being investigated? I'll explain why I'm asking here. I was going through some of the inspection reports into the other homes, and some of the details of inspections into Altamont Care Community contained pretty disturbing allegations of neglect and dehydration. The nursing staff there, multiple members, talked about how they were too understaffed to provide adequate nutrition and hydration. And they said the residents declined because of it. One case is particularly well documented. There was an inspector in the home who witnessed one resident get half of the fluids they were supposed to need, and then they were transported to the hospital for dehydration, where they died. So is that home, for example, also under investigation?
Thanks, Jessica. You know, this has been a tragic circumstance. COVID-19 has disproportionately affected long-term care homes. And then within the long-term care homes, there have been some that have been under extremely tragic circumstances. And that's exactly why, the hospitals were asked to help. Mandatory management orders were created. And we were working to get these homes that needed help, the help that was going to support them going forward. And that's exactly what was done. In terms of the inspections, again, we're looking at what happened in terms of the statement in the Commission of Long-Term Care report. And we're moving forward to make sure that this is looked at with the scrutiny that it deserves. And my heart goes out to everyone who's been affected by COVID-19. But vaccines are making a big impact now. Looking forward, we are seeing much better protection for our seniors and residents and staff in long-term care. And I just encourage everyone to get the vaccine, all the staff to get the vaccine as soon as they're eligible. So thank you.
Seeing no more hands, this will conclude the media portion.